Meanwhile, the push to make changes to health policy in New York continues following the state attorney general's lengthy report on COVID-19 in nursing homes. While the report found an undercount of nursing home resident deaths, it also highlighted several other issues like significant understaffing. Our Capitol correspondent Karina Capabianca has more on proposed legislation that would set new standards.
We have seen this year what happened in long-term care facilities and also acute care facilities. We see that there's a burnout rate from nurses. They're leaving the field.
And in order to reduce the issue of understaffing in healthcare facilities, Assemblymember Eileen Gunther is sponsoring the Safe Staffing for Quality Care Act. The proposal has bipartisan support in the state legislature and the support of the New York State Nurses Association. The concept is to have enough staff at healthcare facilities to properly take care of patients.
It's going back and forth from sending patients with COVID from nursing homes to hospitals. Then hospitals got overwhelmed. They were told to send them back to their nursing homes. And even in the transfer process, patients died because neither place was capable of caring adequately for these patients.
The New York State Nurses Association says the legislation would set nurse-to-patient ratios by unit at hospitals. And at nursing homes, it would set minimum care hours per resident per day.
It's critical to have enough hours of care for these patients to be able to not only provide for what they ask for, but to predict what they might need, because they can't always advocate for themselves.
While some argue that if the legislation is approved, facilities would need to hire thousands more healthcare workers, while there's already a shortage driving up wages, Sheridan Gonzalez says it would incentivize nurses and draw more to the field.
I'm sure they would come back if they knew that they were going to practice under safe conditions and be able to provide the hands-on care that they went into the profession to provide.
The bill passed through the Assembly Health Committee this morning and now heads to the Codes Committee. In Albany, Karina Capabianca.